Welcome back, Dr. Al.
It is great to be here.
Yeah, I mean, you had so much to say the first time. We needed to bring you back so we could dive more into the dentistry part of it.
Well,
Kind of,
thank you. I
yeah.
love this part. It's very interesting and very controversial, but it's exciting, I think.
Yeah, well, like I said before, I don't shy away from controversial. I kind of like both sides of of the story. So, um, but because I don't personally know a whole lot about kind of the biological dentistry side of things, I want you to be able to dive into anything that you feel particularly passionate about. But I do want to start with kind of what we touched on a little bit last time about some of the techniques that you were integrating into your practice as a periodontist. This is kind of how it all started, right?
It is how it started,
Mhm.
and it was a critical change in the way I treated periodontal disease for my patients. Now, most patients really were not interested in what I had to say. They came to my office, a conventional periodontal office, theoretically. Basically, I was doing cutting edge periodontal therapy, like with lasers, but it still was conventional. Everything was centered around the mouth for the most part.
Yeah.
There was very little conversation about what nutrition could do for the mouth, or even more importantly, what nutrition could do for the gut microbiome, which would in turn improve the mouth significantly. And when I started uh, integrating the concepts with my patient, it basically was, how can you have a healthier diet? In other words, not eat foods that are going to disturb your gut microbiome. And how could you then increase the health of the gut microbiome to really affect the mouth? And when I started doing that, diet and probiotics and a variety of other concepts, the patients that accepted treatment got very well. And not only did their mouth get better, and sometimes without even certainly not surgical treatment, a lot of it could resolve by itself if we resolve those other issues, but their overall health was improving. And over time, they came back to me and said, oh my God, I lost 20 pounds. Oh my God, I have no issues with this or with that. And it made total sense. And that's how I integrated it.
And you had some pushback first at first, didn't you?
Oh my God. So I remember one patient, which was very funny. One patient actually, um, an older man that had quite a number of problems, medical problems. And we were talking about how I could treat his mouth with laser surgery and a few other things. And I introduced the idea that if we got the gut healthier, we could get a better result. We couldn't solve his gum problem just with a healthy gut. But after, with the treatment I was recommending with the laser, it would heal better and overall other things would be better. And I started to get into a discussion of diet and a variety of things. And he walked up to the front desk and he told the receptionist, I'm not going to come back. I want you to refer me to a real periodontist. I didn't want to be talked about my nutrition. I wanted to be talked about my gum disease. So, there are people that just don't get the message. And unfortunately, these were my early days of integrating these concepts of health into my periodontal practice. And I probably didn't do it very well. Maybe I came on too strong. I don't know. It was a funny situation. And it still happens several times thereafter. I mean, there are people that just don't want to hear about that. They're in a periodontal practice. They just want to
Yeah.
hear about gum disease. They're not in the mode of being integrated regarding healthcare in general.
And that brings up a really interesting point that I always like to touch on is that, where have we gone wrong in educating the general population on how your body actually works and how what you put in it, what you put on it affects every system, even the mouth, even the gums. And so that it's kind of this wild out there concept when, you come into the dentist at 60 years old and you've got these problems, and all of a sudden, your practitioner is telling you need to change your diet. Like, what?
It really it becomes evident in our current pandemic situation. We have a virus that humans have never experienced before in this particular type of species, and that virus is being treated as an invader, and we have to kill the virus. Somehow, no one is discussing, for some reason, very, very few people are discussing that the immune system is the critical element that we have in our body that keeps us healthy. It fights bacteria and other microbes and viruses, as well as it fights cancer cells in the body. It does it 24 hours a day, 7 days a week. That's why we are surviving. There are viruses everywhere. We've experienced viruses from the beginning of time. So it's not an unusual thing to state we need to improve our immune system, but it's not being discussed. And the only way to improve your immune system is to get involved with the integrated concepts of diet and lifestyle changes to support every organ system in the body. Every cell communicates with every other cell eventually in the body. And it does that with chemicals, it does that with frequencies. It does, your body knows what's going on. And every time you insult it, it gets damaged, and possibly damaged to the point of no return.
Yeah, and it's a really interesting point because I read just the other day, and I believe it was on the CDC's very own website, that 60% of the US population has at least one chronic disease that they live with. And we, to your point, are supposed to be able to fight off viruses and fight off illness. And the true pandemic to me, and makes me quite angry, is that 60% of us are susceptible to crappy outcomes from the flu or from coronavirus. And I don't understand why that's not being talked about more. We have a pandemic of chronic illness.
I'm going to shock you a little bit more.
All right, hit me.
There is a study that was published maybe 2010 or so that showed that the US population has a prevalence of approximately 94% of gum inflammation or bleeding.
Oh my goodness.
Now, let me just explain this to you. It doesn't mean your whole mouth bleeds, and doesn't mean your whole mouth is inflamed, and doesn't mean it happens every day. But some people, when they brush or floss or clean their mouth, they notice a little bit of bleeding in one little area occasionally. Well, this is a sign of infection. It is a sign of a compromised immune system. It is a sign of something going wrong with the gut microbiome that is creating some change in the immune system and chronic systemic inflammation that's affecting the normal healthy bacteria in the mouth. If you look at that statistic, it makes the 60% chronic disease pale in comparison, because we're not talking about this is going to kill you. It's just inflammation. But inflammation is a systemic problem that is causing your immune system to constantly fight a battle it's not winning, and it's getting weaker. So if another microbe, antigen, and a virus comes into your system, it will attempt to fight it. But how strong is it to fight that antigen, that virus, because of your chronic inflammatory condition that you see because of bleeding gums? Let me just give you an example. You're a woman, you're going to put your makeup on in the morning. A guy maybe shaves in the morning. When they do that, they generally do it in a mirror. So if you're looking in a mirror and you're doing what you're doing, if you see a drop of blood come out of your ear, Does it bother you?
Right.
Well, of course. How crazy would that be? Your ears should never bleed.
Right.
But there's no concern when you brush and floss and you spit out and it's a little pink, or you floss, your floss gets a little red. It's normal. You're not concerned. Even when you go to the dentist and the hygienist is cleaning your teeth and you ask her, and you think your mouth is really healthy, and you ask her, how healthy is my mouth? What do you see? And she says, it really looks good. There's just a little bleeding in the lower molar area. She's not concerned. You're not concerned, but both of you should be concerned.
Mhm.
That's a sign of infection. If you were to scrub your nails with a nail scrub brush, would you ever expect the cuticle to bleed? No. The gum tissue is an absolutely protective area around that tooth, and it should never bleed.
Yeah.
And I'll tell
Wow.
you another thing. Dental plaque is healthy until it's not.
Well, that's a new one.
No, it's not.
Dig more into that.
So here is the situation. The tooth is a very interesting structure.
Mm-hmm.
There is no other place in the body where a hard structure penetrates the skin and embeds itself into sterile bone, except the tooth.
Mm-hmm.
The tooth germinates from the bone, pierces the gum tissue, and now you have a monolith, this hard structure that is piercing the gum, embedded in sterile bone. If the body didn't take care of that very, very tenuous situation, the area where the tooth pierces the gum, then bacteria could easily slide down the tooth like a sliding board. They're microscopic, by the way. You don't see them. They slide down the tooth like a sliding board into the sterile bone, and the sterile bone becomes necrotic and you'll lose your jaw. Now, does that happen? No. Why does it not happen? Well, the body has created a lot of biological defenses to prevent that. It's a unique area in the body. It has a unique protective mechanism. There's a lot of stuff going on under the gum to prevent that. But there is one other layer that is superficial, that is the initial protecting guard for that very tenuous surface where the tooth meets the gum. And it's a biologically beneficial biofilm. And that biofilm is called dental plaque. So dental plaque is made up of maybe up to 700 different species of bacteria. Every individual may have 200 or 300 species in their own dental plaque. And that dental plaque garden of bacteria works in unison to protect that crevice. It produces hydrogen peroxide that actually is a natural killer of potentially pathogenic bacteria in the mouth. So in the mouth, if you have some potentially pathogenic bacteria, the dental plaque will kill it before it can get to this crevice where it could slide down under the gum. Also, it has chemical buffers in the plaque that protects the acid level so that the acid doesn't get more acidic than a pH of 5.5. So a pH of 5.5 and lower, which would be more acidic, will actually cause tooth decay. If it's above 5.5, tooth decay doesn't occur. So there's buffers to protect that. And also the dental plaque acts as a gatekeeper. It actually allows the minerals and other nutrients in the saliva that pours into the mouth 24 hours a day, 7 days a week, more when you're awake, less when you're asleep. But those minerals and nutrients can penetrate the dental plaque and get to the root to remineralize it as necessary. So dental plaque is healthy. It's critical. You don't remove it unless it's unhealthy.
So you could liken it to like good and bad bacteria in your gut. So dental plaque
Yes.
could be looked at as kind of a good bacteria on your teeth.
Its combination of bacteria is made up of some potentially pathogenic bacteria and not so pathogenic bacteria. There are very pathogenic types of bacteria in the dental plaque that play a protective role as long as they're kept under control. And healthy dental plaque creates a balance or a homeostasis of all these different bacteria. But when the dental plaque or the environment or the immune system is compromised, then some potentially pathogenic bacteria can overgrow in the dental plaque. And bad foods like sugars can feed these very potentially pathogenic bacteria to become very pathogenic and then create disease. But you don't kill potentially pathogenic bacteria when they're in balance, because it would still throw off that balance of the dental plaque.
So it's the food that you're feeding the bacteria with that become the problem, not the plaque itself.
Well, the food can feed the bacteria, but the dental, the gut microbiome, the bacteria in the gut are even more critical for the health of the dental plaque. Most of dental diseases start in the gut.
As do most chronic diseases.
Absolutely.
Wow, that's fascinating, because you never really think about dental plaque being a gut
Let me tell you
issue.
give you another story, which is a study that was done a bunch of years ago, but not so long, maybe 2012. It was a small study. It was done in Switzerland, I believe, and they used 10 people. It wasn't a well-controlled study because it wasn't a double-blind study, but it's very interesting. It's one of the first that was done that proves the point. 10 people in an area of Switzerland were given a task. They lived in an environment, or they were put in an environment where their primal ancestors, maybe 5,000 or so years ago, lived. And they had to live like that. So they only could eat unprocessed healthy foods. They could not eat any processed foods. They also could not brush or floss their teeth for 30 days. Now, in
Wow.
the beginning of the study, these individuals had their bacteria around the gum, the dental plaque, bacteria around the tongue, and the condition of the gum tissue and the health of the gum measured. All of them had certain statistics. They had dental plaque, they had lots of bacteria, some of them had gum inflammation, but that's the way it was. After 30 days, they could not brush or floss at all. When the 30 days were up, they only ate that unprocessed food. The 30 days were up, the same bacteria were examined. They had much, much more bacteria, but the bacteria changed into a more basically homeostatic or balanced state in the gum tissue as well as the tongue. In addition, the gum tissues that were inflamed and bleeding subsided, and the tissues got healthier over 30 days, even though they couldn't brush or floss. Since then, a couple more studies were done, but they were better controlled. They were double blind, and they had subjects that were all of them had gum infection. They all ate a very, very poor diet. Half of the subjects then changed their diet to a healthy diet and could not floss between their teeth. The others continued with their unhealthy diet, and they could not floss between their teeth. And they did tests of the gum tissue and the inflammation and the bacteria before and then 30 days after, and the same results occurred. Basically, a healthy diet changed the healthy gut microbiome to allow inflammation, systemic inflammation, to subside. And the cytokines and other elements of systemic inflammation were not present, and the mouth responded, and the bacteria became healthy.
Wow.
Without brushing or flossing. Well, without brushing.
it's kind of it's kind of the caveman theory. We have we have a saying in our house. Anytime there's a habit or something that we do, um, that maybe the cavemen wouldn't have done, like brushing or flossing, my husband will say, well, what did the cavemen do? Why did they not have to brush and floss? But it's kind of that whole theory.
But
They were
they
eating.
didn't have to brush or floss.
Right.
And we know that because we can look at skeletal remains
Hmm.
from 10 to 20,000 years ago. And they were eating basically a healthy diet because the food was not processed then.
Straight from
And
the earth. Yeah.
right, straight from the earth. And so we can look at the jawbone, and the jawbone was relatively intact, meaning they didn't have periodontal disease. We can look at the teeth, and the teeth were relatively intact for the most part, no decay or very, very little decay. And they did have broken teeth, but that was the trauma of the day. But they had relatively healthy teeth, relatively healthy bone, and they had calcified substances between the root of the tooth and the bone, which was dental plaque that calcified to tartar. And there was
Hmm.
no disease because there was no unhealthy garden of bacteria in their mouth to cause the gum disease or tooth decay.
So would you say then that there's a combination of um, poor diet and all the processed sugars that we eat, and then also over sterilizing your mouth
Well,
that's
that
causing
that
problems?
is absolutely true. You do not want to use antimicrobial agents in the mouth, like antimicrobial toothpaste,
Mhm.
antimicrobial mouthwashes on a daily basis. For example, to stay healthy, would you take a capsule of penicillin every day? If you
No.
took a capsule of penicillin every day, you would destroy your gut microbiome and you could be a pretty sick puppy over time. And you would stay sick
Yeah.
because you killed all this good bacteria. The same is true of the mouth. There is no reason to do that. Now, if you have infection in the mouth and it needs to be brought under control, especially by a well-trained dentist, then maybe an antimicrobial mouthwash is necessary for a week to 10 days to get things under control. It will kill the overgrown bad bacteria and it will damage some of the good bacteria. And that dentist, if they know what they're doing, needs to incorporate methods to change the diet and support a healthy gut microbiome, maybe with some very specific probiotics or other medicaments to get that garden of bacteria in the gut healthy and to improve the immune system in the gut, as well as to improve the gut epithelial barrier.
But like an antibiotic, it's temporary. It's for a short
It,
amount of
it
time.
must be temporary and for a short period of time,
Yeah.
and only if it's necessary. Because a lot of times you can reduce inflammation by just changing the diet and improving the gut microbiome with never using an antimicrobial or an antibiotic.
That's so counterintuitive to what so many of us do, with our
I
dental
know.
care. It feels, yeah, I imagine that that's what you're, you're
But you started off the conversation
yeah.
knowing that the CDC says 60% of the US population has a chronic disease.
I know.
70% of the US population, 70% of deaths in the US are a result of a chronic disease. And 72% of the US population is either overweight or obese. And that's according to the CDC. And I'm not so sure they are not underestimating these numbers. So the fact that we're doing all these things to kill good bacteria is affecting our immune system and is actually promoting chronic disease.
Well, and to your point, I don't think that at this point we're screwing up. Our health agencies are sucking at their jobs. And so for this concept and this idea to be pushed aside or not even investigated, I think would be a travesty.
It
Because
would.
obviously what we're doing now is not working as a
Correct.
whole. I mean,
Correct.
our overall look and approach to healthcare is a mess. It's not working.
Correct. So I think I think that there are basic elements that every individual could do. Number one, you do need to have a method to clean your mouth appropriately. I would never, ever recommend removing all the dental plaque, but overgrown dental plaque, because we're not eating healthy, we don't have a healthy gut microbiome, we're going to have unhealthy dental plaque. We need to understand how to clean well. And to clean your mouth well is basically using a toothbrush properly, soft bristle toothbrush, brushing into the gum surface properly, cleaning in between the teeth, using a little floss to remove fibrous foods between the contact, and using interproximal brushes like a particular brand I like is called the TP Easy Picks, TEPE Easy Picks. Silicone, they look like a toothpick, and that you go in between the teeth where the tooth meets the gum. It scrubs off the unhealthy bacteria, but it doesn't remove the underlying very healthy dental plaque. Scrape your tongue to remove excess bacteria at the base of the tongue, on the top of the tongue, which is where 90% of dental mouth odor comes from. So if you do these things correctly, and I have a paper that I can send you and you can give to everybody that's viewing this,
Yeah, I'd love
called
to include it.
4 steps to a healthy mouth, and it goes into the details with some pictures on how to do that. And you brush with water, or you can brush with a little bit of baking soda, maybe, or you can use a very, very healthy natural toothpaste. One of the toothpastes that I do recommend when I recommend a toothpaste is a toothpaste called Revitin, Revitin. They have a website that you can get it on Amazon, you can get it on their website, but it is a very natural toothpaste. You could eat it and it wouldn't harm you. There are no chemicals in it that's going to disturb your gut or your mouth microbiome in a negative way. So it has a nice, fresh, citrusy, orangey flavor. It's a very nice toothpaste if you want to use a toothpaste. But the point is, you must remove unhealthy bacteria in your mouth. That's number one. Number two, you have to have a healthy diet. You can't eat these refined carbohydrates. All the processed foods, if you look at the labels, have all these unhealthy chemicals, lots of processed carbohydrates, unhealthy processed vegetable and seed oils, a huge number of chemicals and preservatives and emulsifiers and all kinds of coloring, synthetic dyes and synthetic flavors. All these chemicals are very disturbing to your gut microbiome. So you have to eat a healthy diet which is nutritious. I lean toward a carnivore diet. I've written a paper, a little mini ebook called The Better Belly Blueprint, which is my concept of a healthier way of eating, eliminating the foods that are toxic to the gut microbiome and eliminating the foods that feed an unhealthy bacteria in the mouth. So these are important. You also have to reestablish a healthy gut microbiome. There are some unbelievably interesting studies that were just published recently that show that the healthier peoples, let's look at maybe some of the primal societies today, one of which is the Hadza in Tanzania. When medical researchers look at their gut microbiome, that garden of bacteria in their gut, they find many, many, many varieties of species and many, many numbers of each of these varieties. That diversity of a gut microbiome is called alpha diversity. Those types of that type of healthy gut microbiome prevents chronic disease. And if you look at the Hadza, they have almost no chronic disease. They have almost no gum disease or tooth decay. They don't have high blood pressure. They have a healthy lifestyle, although some of them are getting a little more westernized as time goes by. But it is true that a very diverse microbiome supports a healthy immune system and prevents chronic disease. So if you can utilize certain natural methods like spore-based probiotics that are actually resistant to stomach acid, and they generate in the gut itself, and they stimulate your own gut microbiome to grow in numbers and quantity and quality, then you can develop this alpha diversity, a high alpha diversity. And that's critical for overall health. So make sure you know how to clean your mouth. Make sure you have a diet that is not only giving you the right nutrients, but it doesn't provide the irritants or the splinters, so to speak, that would damage the gut microbiome and the gut epithelial barrier. And certainly make sure that gut epithelial diversity, or I mean that gut microbiome microbial diversity, is very, very significant.
So you have to have a very willing patient to take these steps. If they really truly want to get the health of their mouth back to optimal, you have to be able to educate people to look at the body as a whole and to understand that
Absolutely.
it's coming from somewhere else. How do you do that? I
Well,
mean, how do you integrate this kind of dentistry into the mainstream?
it's not easy, right? Because most people only want a pill. Today, with the COVID epidemic, ask the average person, what are they trying to do to get healthy or prevent this virus in their system? And they're doing the things that they're told to do: wear a mask, socially distance themselves, wash your hands. All these things may be absolutely beneficial, and get the vaccine. Are they even suggesting that they need to improve their immune system, which would in turn have them lose weight and prevent all these other chronic diseases, which the virus is acute at first, but it could create other chronic problems? They don't understand that. So a person needs to have an emotional involvement to make a change. I can tell you and every listener to this podcast of the things do, and they may understand it completely, but they don't make a change because they're comfortable with where they are, and they don't see the emotional effort or the emotional result. If you have, for example, an emotional situation going on, or a situation in your life that creates an emotional reaction, like you're getting married and you want to change your life because you're getting married, so you're going to make a change in your life, your diet, your lifestyle. Or you're having your first child, you want to see your child grow up and become an adult, so you're more motivated to make a change in your diet or lifestyle. If you had a grandchild, you want to see that grandchild grow up. But if you had a heart attack or a stroke or cancer like me, and you survived that, you may have the emotional willpower now to say, oh my God, look what I did to myself all these years. I need to stay or get healthier.
Yeah.
And that emotional reaction to the factual information is the trigger to motivate you. I can't motivate you. You need to self-motivate. But if there is a social, emotional reason, it could be just getting a new job, or something where you're changing something and you have to have a visibly more healthy appearance that may stimulate you. There are only a number of things that will motivate you, but whatever motivates you has to be the factor to get you started.
Yeah, and back to this idea that we're not putting enough of the, I don't know, empowerment into everybody's hands, especially as it pertains to coronavirus. I think if more people knew that they had control over their own health, it wouldn't make it as terrifying.
You're right.
It wouldn't make this virus so paralyzing to some people,
You're
because
right.
now we're relying on, I guess, what I have been calling artificial health. Cover your face, don't go near your community, don't go near your family, get the vaccine, get an injection. It's all artificial. It's all not true health. But if you told somebody there are ways to boost your immune system, that getting a virus isn't scary, um, I think it would be more empowering to more people, and we could kind of get this ball rolling on.
Well, I totally agree with you. Sometimes you have to ask the question, what would you do if I told you that you could prevent this type of chronic disease or that type of chronic disease?
Yeah.
If you did a health history on a patient and knew that they had certain problems, you could ask the question, would you be interested in helping your body to prevent this cardiovascular disease that you have, or to change the course of it, or maybe even possibly cure it? Would you be interested in some different concepts, not medicine, not taking supplements and taking prescription drugs? Would you be interested in changing your lifestyle to improve that condition, or maybe improve that condition for your spouse or your child? And
Right.
maybe that will trigger an emotional response. And see why, the question why comes to mind, that they would do something.
Yeah.
And if you can figure out their why, you can maybe help them then to create these protocols to create a healthier diet and a lifestyle.
Yeah, it's beyond me sometimes. It's kind of that whole idea of, if I told you that you could eat broccoli every day for 6 weeks and reverse this health condition, or take a pharmaceutical for the rest of your life, which would you choose? And many people would choose the ease of a pharmaceutical rather than changing their diet or changing their lifestyle. I don't know.
Another question you might ask for a person that is more practically oriented, and that is, would you want to change some things in your life to avoid the financial costs of medical insurance and disease later on in life?
Oh yeah, I've broached this on the show before. I mean, the cost of integrative medicine, alternative medicine up front looks terrifying because insurances do not cover this kind of care. However, preventative care is going to cost way less in the long run.
Absolutely. Absolutely. And
Yeah,
you're going to feel better, and you won't have to suffer the chronic degenerative diseases that you would be taking medicines for, yet it would never solve.
right.
So these people that are chronically ill are chronically ill. They're on
Yeah,
lots of meds. Their quality of life is slowly deteriorating,
right.
and they're spending lots and lots of money on meds and medical bills if the insurance is not covering it.
Right. Yeah, it's saddening. It's saddening. Now you actually you took everything that you were doing in your practice, and do you now work with an integrative medicine hospital? Is that correct? Or are you on the board somewhere?
No,
How are you involved?
I've done, the College of Integrative Medicine has put me on their faculty. It's an online program that
Okay.
I wrote a program for periodontal disease, relating it to healthcare professionals and how they can integrate that into the overall healthcare concept. One of the very important things about the mouth that is not understood by healthcare professionals is that the mouth can be an area of insult and basically splinters that never get removed. So,
Mhm.
if you're the healthiest person in the world and you had a splinter in your finger, um, that splinter causes an irritation in the skin, and it just doesn't go away no matter how healthy you are until you remove the splinter. It's so obvious. But if
Mhm.
you took the splinter and stabbed it into the original puncture wound every week after that, it still would not heal. And so the splinters in your body, if you have them, need to be removed. So if you're eating foods that are irritating to the gut and they're damaging the gut microbiome, they're creating perforations in the gut epithelial barrier, they need to be removed. Not only a healthy diet with nutrients, but a healthy diet with no irritants. Well, if you have unhealthy situations in the mouth, like a broken filling, a broken tooth, bad restorations that have been done dentally that are not done properly, that are irritating the mouth, infections under the gum and the bone, extraction sites that were not properly cleaned out, root canals that are failing, things that you may not even be aware of without pain or without swelling you may not be aware of, then those areas are the splinters like I referred to in your finger. And
Mhm.
if you have a healthy diet, if you have a healthy gut microbiome, you are exercising, you're sleeping well, you have great control of your emotional stress, everything is right, but you have some irritants in your mouth that you're not aware of, you will have damage to your gut microbiome, you will have damage to your immune system, and it will be chronic, and no one will be able to treat it because they don't know where the splinter is because they're not looking for it.
Mhm.
Remove the splinters in the mouth, in other words, repair the mouth if necessary that's damaged, then you do all these other things and there's no other irritants that are causing problems
So
that you
what
can
you're
control.
yeah, so what you're saying is those root causes for your chronic disease could originate in the mouth. We're just not looking for them.
There are so many patients, people that I consult with all over the world that are having issues that have seen a variety of integrative physicians,
Mhm.
and they're treating them maybe properly in the gut and the diet area. They've never looked at the mouth. And when they send me their dental x-rays, I can show them, with Zoom, and I can share the x-rays on a screen. I can show them what I see and direct them to a dentist that is maybe more biologically oriented, understands this root canal is failing, it's causing infection that's spreading into the circulatory system. It's not painful for the patient, it's not causing swelling for the patient yet, but you can see the damage in the bone that's created. Get that tooth out, remove the infection, and at least the irritant that has never been identified is gone. And
So
the
the
immune
splinter is
system can
gone.
then respond properly.
Yeah. Wow. That's yeah, that's fascinating. That's kind of one of those areas you don't spend too much time focusing on. And it
No,
could
and
be
a
the
lot of dentists
and it could
don't
be the root of
spend,
all your problems.
yes, and no pun intended.
Very
And,
literal.
but
No, I intended that one.
okay, but the problem is a lot of dentists don't do that either. So a lot
Yeah.
of dentists don't understand the systemic contribution and insult
Yeah.
that the mouth has on the rest of the body, and and they're not necessarily looking at what's happening to the immune system. They may only be interested in, oh, you have a gum infection, we'll treat it conventionally and you'll
Yeah.
be on this antimicrobial mouthwash forever
Right.
to kill the bacteria. Although you're killing a lot of good bacteria, they're not, those dentists may not be aware of that and understand the negative side to
Yeah.
killing all these healthy bacteria that changes everything in your mouth and systemically.
So let's I want to touch on something kind of controversial that comes up in the wellness communities quite a bit, and that's fluoride.
Yes.
Fluoride in toothpastes, fluoride as kind of a film after a cleaning, fluoride in water. Can you touch on how in a more holistic dental practice fluoride is looked upon?
So fluoride is a chemical that actually um, will help to prevent tooth decay and even gum disease.
Mhm.
And it does that in an unnatural way, but it does that in the mouth. It creates a barrier. It can inactivate a lot of microbes. It can also create a barrier that is more impervious on the root of the tooth to tooth decay. But it is a unnatural barrier. It's like taking Rust-Oleum and painting it on a rusted pipe and saying, now it looks beautiful, but it's rusted underneath and it will
Right.
still chip off and continue to rust. The most important thing, in my opinion, and fluoride is a neurotoxin. So fluoride replaces iodine in the thyroid. It can affect neural tissues. There are some studies that show that mothers that are taking it fluoride, newborn babies may actually have a decrease in IQ because of the neurotoxic properties of fluoride. There are many, many papers related to that. And it is a controversial subject because there are other scientific medical papers that say it's not true. So the question is, what do you believe? Well, it is a chemical that is neurotoxic. Maybe it has to be in high concentrations to be visible as a neurotoxin. But my point is, if it's a little bit of a neurotoxin and you only have a little bit for a long period of time, it accumulates to be a lot of it. And eventually, it could become a problem years or decades later after the accumulation. The reason that fluoride is used in dentistry is theoretically to prevent tooth decay. Well, there are very natural ways to prevent tooth decay. Number one, don't eat refined sugar. Now, what does that mean? Well, sugar, refined sugar is a recent product. It's not something that our ancestors ever had. We ate sugar, we ate fruit, we ate honey, we ate sugar in different ways, but not this refined sugar that we do constantly. Every meal that we have, every snack that we have has some kind of refined sugar. Everything.
Like
and it's
bread,
unhealthy sugars.
Right.
So the point is, there was a paper that was published in the Journal of Dental Research maybe 7 or more years ago that reviewed all the science between or up to that point that talked about what causes tooth decay. And the bottom line was tooth decay is caused by sugar. If you remove the sugar from your diet, you can't have tooth decay. Starches do not cause tooth decay unless starches are combined with refined sugars that you're eating. So if you can reduce the sugar in your mouth to a very, very low or almost zero concentration refined sugars, you're going to do fine. Does that mean you have to not eat blueberries anymore? Of course not. You can eat, and blueberries are healthy in a concentration that is normal. But refined sugars, table sugar that you're eating, that you're adding to everything, you can eat the blueberries, but you don't have to have the powdered sugar on top of it to make it even sweeter. So that's okay. Honey is very healthy. As a matter of fact, I will tell you that raw honey has been studied to help prevent tooth decay and gum disease. It's amazing. It's sweet. It's sugar, but there's also 200 or more biologically active chemicals in honey. Honey is actually an antimicrobial, fungal, antibacterial type of product with lots of healing qualities.
And it's a straight animal product.
And it is an animal product.
Yeah.
Absolutely. It is an animal product.
So am I right? Am I correct in saying that there are a lot of other developed countries that do not use fluoride the way that we do in this country?
Well, I am sure it is. I haven't done the research. I am sure it is. Our country is a relatively unhealthy country from a nutritional standpoint. From a metabolic standpoint, we are one of the lowest in the health range of countries in the world, which is very interesting because we're one of the wealthiest countries in the world. Yeah. We theoretically have the most expensive healthcare system, but it's not doing a whole lot of good for a whole lot of people because a lot of people, like you said in the beginning, are not taking proactive steps to get their bodies healthy. They don't understand what it is to be metabolically flexible. And I've written papers about that. And that is a critical concept that we are not in this country.
We've created a system where we forget that our health is our responsibility. We've created a system where so many of us rely on, a health care system to tell us how to take care of ourselves instead of, a lot of the wisdom that used to be passed down on, how to take care of yourself, if that makes sense. Not to be redundant, but we forget that, we we are responsible for how we treat our bodies, nobody else.
But we also have to know how to treat our bodies.
Right.
One of the papers that I wrote that I talk about a lot is our DNA blueprint. So, our DNA basically is our blueprint for life. This is how we get structured. This is our building plan. And our DNA has evolved slowly over the millennia of evolution. And interestingly, 99.9% of your DNA is the same as my DNA. What makes you, you, and me is only 0.1% of the DNA and all the epigenetic factors that upregulate or downregulate our individual genes. So we are basically all the same. And our DNA basically says two very important things on one extreme and the other extreme. On one extreme, it says you must eat nutritious food or you're going to die. You must breathe air or you're going to die. You must drink water or you're going to die. And everybody knows that. And we do all three of those things. On the other extreme, interestingly, it says, I do not have the capacity to create the proteins and enzymes to detoxify and digest certain products you put possibly in your body. And I will then call them poisons. So don't eat poison or you eventually could die. And we eat those poisons every day. It's part of our breakfast, lunch, dinner, and snacks. Refined sugars, processed seed oils, anti-nutrients that are in some plants that are very damaging to the gut microbiome that we cannot digest. Animals can digest them and absorb the nutrients after that, but we can't digest many of them, and we eat them all the time. So what we're doing is ignoring our basic DNA blueprint. There's everything in between those extremes that we can eat comfortably. We are omnivores leaning towards carnivore, leaning towards animal-based foods, interestingly, not the vegan side. We are omnivores. We can eat lots and lots of things, and we can enjoy all these things that don't irritate the gut. But if you eat foods that irritate the gut and damage the epithelial barrier, you will have what's called a leaky gut. You will have systemic inflammation. You will have chronic disease, including gum disease, tooth decay, and cancer.
It's a very slow inflammatory death.
Yes,
It is. It's
That's why people don't jump on the bandwagon, because they don't see the results. You don't eat a fast burger today and you develop Crohn's disease tomorrow, or cancer tomorrow, or tooth decay tomorrow. It doesn't happen that fast.
Right. Well, to wrap up, I would love if you could give just a little bit of hope towards where we're heading and what all of us can do to help our healthcare system kind of get to there. And also, like, what can we do as individuals to push our practitioners to look more into these methods?
I would share the information I'm just describing with certainly your family, and have a conversation about what would it mean to do some things that could be fun to do as a family, by the way, that would actually prevent serious, chronic, debilitating disease years in the future. And that's a hard concept to get your head around, because it's so much in the future. And a young kid is not going to think about what's going to happen when he's 60 and he's only 18 right now. But it's a true statement. I know that, and I'll send you my PDFs, but I know if you clean your mouth the way I'm explaining it, you won't have gum disease. For the most part, if you take care of everything else I'm saying. If you have a healthy diet, like I talk about in the Better Belly Blueprint, you're not going to have nutritional problems. If you improve your gut microbiome, like I describe in some of my protocols to utilize spore-based probiotics and a few other things, you will have a very healthy and diverse microbiome, which is the most critical thing. If you can get your mouth healthy, and anything that's irritating in your mouth repaired, get your diet under control, and make your gut healthy. You will do so many things. And guess what? It's not going to be very expensive to do that. And if you do that as a family, it can be fun because all of the members of the family can participate in buying of the food and understanding how to clean their mouth. And I mean, it is a very personal protocol that you can share with your family and then with your friends.
Yeah. Wow. Well, I've enjoyed both of our talks, and you've had a ton of great information, and I will include all of that in the show notes for this episode. Again, I'm so grateful for your time and
It's a
expertise.
pleasure. It's
Yes.
a pleasure. It's a pleasure. Absolutely anytime. I'm always available. I do coaching, as you know, I do just individual consultations. I am available to anybody who wanted to contact me. My website, drdanenberg.com. There's a contact section. You can type in your message. It'll come directly to me. I respond to every email that comes to me. So
Oh my goodness.
you contact me and I will respond to you.
Wonderful. Thank you so much. And again, I'll include all of that for anybody who may need a little extra help from Dr. Al.
Yes, I'll send you all the links and you can choose what you want to put up.
All right. Thanks, Dr. Al.
Fantastic. You be good. Take care.
You
Thanks.
too.